ദൈവനാമത്തിന് മഹത്വം ഉണ്ടാകട്ടെ. ഞങ്ങളായിരിക്കുന്നത് ദൈവകൃപയിലാകുന്നു എന്ന് സാക്ഷീകരിക്കുന്നതിന് ഞാൻ കുറച്ച് ആദ്യമായിട്ട് ഉപയോഗിക്കുകയാണ്. ഇന്നത്തെ ഈ ചടങ്ങിലേക്ക് ഞങ്ങളെ ഇൻവൈറ്റ് ചെയ്ത ബഹുമാനപ്പെട്ട അന്വേഷണത്തിനോടും ഇതിൻ്റെ എക്സിക്യൂട്ടീവ് കമ്മിറ്റി മെമ്പേഴ്സിനോടും പിതാവാനോടും ഞങ്ങൾക്കുള്ള നന്ദി ആദ്യമായിട്ട് അറിയിക്കുന്നു. നിങ്ങൾ മിക്കവരും ഒരുപാട് പേര് മെഡിക്കൽ പ്രൊഫഷനിലുള്ളവരാണെന്നറിയാം. ആൻഡ് മോസ്റ്റ് ഓഫ് യു ആർ നോൺ ടു us one way or other. We have been in this profession for the last 50 years, since 1976, 78, 78. And I'm sure most of you were not born at that time. So, and half of our career in medicine has been in Australia and in a different capacity, because I was mainly a surgeon, ENT and a general surgeon while working in India and African countries. But after coming to Australia, I became a GP, and Lizy has been experienced in, has got qualifications in pediatrics and gynae before coming here as a GP. So enough has been told about our background, and I don't want to go in. I thought I should introduce myself, but I think you got all this information from AI. I don't know. What you said is all correct. So are we all healthy? That is the question. Because I'm not going to talk much about health matters, because most of you know about it, being in Australia especially. And I would like it to be an interactive session where you can ask us questions, and then we will answer as well as we know about the topic. Our concept about health is that if you do not have a diabetes, hypertension, cancer or heart problems, we are healthy. That is our usual concept among our Malayali population especially. But World Health Organization defines health as a state of complete physical, mental and social well-being, and not merely absence of disease or infirmity. So we are just thinking that we are healthy because we do not have a health problem. But when we go into the details, we will know that we are having health problems in one way or other. Most of us will be having health problems in one way or other. 50 years ago, India was an underdeveloped country. We were in 1972, we became medical students in 1973. India was an underdeveloped country, but Kerala was the best in healthcare provider in India. But even then we had limited resources. We had only investigation available was X-rays and blood tests for TC, DC, ESR. We say total count, differential count. Those were the only investigations available 50 years ago when we were medical students. So no effective medications were there at that time. We diagnose patients with our clinical knowledge without any help of any investigations, and we treat them. Only 5 or 6 types of antibiotics were known at that time. Now we have got at least 100. And communicable diseases, that is infectious diseases, was the most common cause of infant mortality at that time. But in these last few decades, we came on a long way. We have got exponential growth in medical knowledge, medical equipments, and a revolutionary treatment in most of the conditions. There was a time when there was no cure for cancer, but now we know that we have got a cure for many cancers, even if it is not for all. Diabetes mellitus, hypertension, coronary heart disease, cancer, all the new world, we have got treatment, more effective treatment. The advent of ultrasound scan, CT scan, MRIs, fiber optic equipment, that is the endoscopy equipments, PET scans, everything has revolutionized the management of very chronic health problems in our society now, especially when we are in Australia, in a first world country. But then what happened is gradually our emphasis shifted from treating diseases to preventing diseases. That is when the immunization started. We have eradicated a few diseases, smallpox. You must have heard of that disease in your history or medical in your studies. There was a disease called smallpox, poliomyelitis, and all these conditions were effectively prevented by immunization programs. Still, there are people who refuse to their children to be immunized. That is what we call ignorance. When these immunizations and then the screening came, and that is what we are all concerned about now. When I was told that I should be talking on the bowel cancer and colonoscopy, that is one of the recent advances in the life which happened in the last 25 years. We used to have a mammogram and pap smear for ladies. For men, we used to be doing PSA, the prostate specific antigen to diagnose prostate cancer at an early age. And both men and women go for colonoscopy after FOBT, you know what it is, a stool examination to check if there is blood in the stool. But the most important part I want to emphasize is this prostate cancer or bowel cancer, very rare in our Malayali community. We haven't seen many cases after coming here, Australia. Breast cancer is common, I do agree. So what happens is with these screening techniques is we can make an early diagnosis of problems and which helps in making more effective treatment, and that makes a better prognosis in most of the conditions. I must emphasize one point that colon cancer, breast cancer and prostate cancer can run in families. So if your parents or your first degree relatives have any of these conditions, be careful. You need regular screening for colon cancer, breast cancer and prostate cancer. So after this screening, we went into the how to promote health. That is our latest attitude towards health. We know the causes of most of the diseases now. Some are genetic, which hardly can be treated, but we are doing our best to do research on that matter. Most of our diseases these days are lifestyle related. Our habits, or sedentary life, we're doing office work, we're hardly doing any work at home or in the office. Eating habits, with no control for eating, restricting our diet. Then of course the vices of alcohol, smoking, drugs. Drugs I don't think it is a common problem in our community. Smoking also is coming less and less, but alcohol problems really exist in our community. So all this leads to what we call obesity, Obesity is a major problem which can impact on our health. So we are trying to do health education to reduce the ignorance about, when in the olden days, I remember when I was a child, if I see a person who is fat, we always used to come and say, he is very healthy. But now the outlook is different. If you see a person who is fat, obese, we classify that as a disease, he has got a disease. So we should be not neglecting our eating habits and exercise programs to help in reducing obesity. And I'm sure that all of us, or most of us, are aware of that obesity problem. So lifestyle changes are recommended highly by dieting and exercise. Most often what I find is we neglect our health. It's mostly many gentlemen come to see me, it is because their wife, ഭാര്യമാർ പറഞ്ഞിട്ടാണ് വരുന്നത്. Go for a blood test എന്ന് പറഞ്ഞു വിടുമ്പോഴാണ് they usually neglect the health matters, And then when they are asked to come for follow-up, they may come after 2 or 3 years for another blood test. That is what we usually see. So it is not they are not following our instructions clearly. Then some people are obsessed, If you have got a thyroid problem, they want the test to be done every 3 months. It is not absolutely necessary. PSA test, the government recommends it to be done every 2 years. But some patients come asking for it to be done more frequently than that. Some people are called hypochondriac, not very common, but they think that they have got a disease. And they go for investigations which are not recommended by doctors, but they want this CT scan done. I have got a colleague in Gold Coast who, whenever she gets a headache, she goes for an MRI break. When she gets a pain, she's a GP, I should say, but she goes for also. That is a sort of hypochondriac, And not only for her, she does it for her family members as well, So I should mention about the mental health. A healthy mind is important in having a happy life, healthy life. So in our day-to-day life, I'm sure almost all have got stress factors to a lesser or a greater extent. Stress could be at work, at home, with your spouses, maybe financial matters, or in your social life. There could be your friends, there could be problems caused by your friends in the church or the community as such. So it all impacts on our quality of life to some extent, or a great extent, I would say. It leads to anxiety, depression, insomnia. Some people cannot sleep, and tiredness. One main problem with our Malayali community, whether in India or even after coming here, is that we are not ready to accept that we have got a mental health issue. That is our cultural, it's a taboo to say that. I myself blame myself for that. My family members, they will not come up when they have got a problem, stress factor, They want to hide it. If I am from Cherian, and if I have got a problem and one of my relatives have got I go to Kannur or go to consult a psychologist, because we are not ready for others to know that we have got a mental health issue. That attitude should change. Of course, the church can play a great role in mental health issues, I think. The social well-being, that is the last topic I would like to emphasize. For the social issues are different for children, for middle-aged people and elderly people. We are living in a first world country, and of course, roti, kapda or makan not a problem for us. We have got better living conditions, but not like in India. Still, that is a problem in India. But I think even whether you admit or not, we have got relationship problems with our partners. Parents and children have got relationship problems. We have got problems with our friends. I think we hate some people. I should warn you that that is a mental sickness and that is a self-limiting problem. Please do not hate others. That is like spitting or lying down and spitting. When you hate somebody, the impact of that is on you, not on the other person. So this, in India at least, when we go through the newspapers, we can see that these sort of issues can lead to separation, divorce, sometimes suicide, and even homicide. If you open the news, every day we see stories of that all over Kerala. Luckily, we are blessed in that in Australia at least. So for old age, I think in another 10 or 20 years or maybe 30 years, most of you or many of you will be the aging population. That condition is, we are fast going to be, now we are all middle-aged, I would say, but old age, it is going to be a real problem in the future we are going to face. Then comes the emptiness syndrome, Children leave you for their work or after marriage. You become isolated, only husband and wife. And sometimes if the partner is gone, then it's a solitude, lack of support. Disability can decrease your quality of life. But that is when the church will have more role to play. Nursing homes, aged care, all those are future problems we have to face. So before I conclude, I would like to confess one thing. Ultimately, we all believe in God. We are Christians and we believe in God. We doctors or anybody in medical profession are just tools in God's hands. We can predict that this patient may not survive, but we do see miracles in our medical profession, unexplained. I myself had a lot of miracles in my life, in my personal life. Eventually, what matters is our faith in God, our prayers, and God's grace. That is what eventually matters in all the health matters. We are just tools in the hands of God. Thanks for listening. I think we should now go to the question and answer. Dr. If you have good questions, you want to talk something?
Cherian topics cover നിങ്ങൾക്ക് എന്തെങ്കിലും ചോദ്യമായിട്ട് ചോദിക്കാനുണ്ടെങ്കിൽ ചോദിച്ചാൽ better for me. സ്പീച്ച് പ്രിപ്പയർ ചെയ്യുന്നില്ല. It will be boring സ്പീച്ച് ഇങ്ങനെ കണ്ടുകൊണ്ടിരിക്കുന്നത്. സോ എന്തെങ്കിലും ചോദ്യമുണ്ടോ ആർക്കെങ്കിലും?
One of the topic recently, ഞങ്ങളുടെ മെജോറിറ്റിയുടെ ലേഡീസ് ഉള്ളതുകൊണ്ട് പെരിമെനോപോസും മെനോപോസും നമ്മുടെ ഇപ്പോഴുള്ളൊരു ജനറേഷൻ യങ് ജനറേഷന് കുറച്ചുകൂടെ അവയർനെസ് കാണും. പക്ഷെ ഞങ്ങളുടെ ഇപ്പോഴത്തെ ജനറേഷനുള്ള ഹസ്ബൻഡ്മാർക്ക് ആണുങ്ങൾക്ക് അതിനെക്കുറിച്ച് അവയർനെസ് കുറവാണ്. നമ്മളതിനെ ഫേസ് ചെയ്തിട്ടുള്ള ഈവൻ ലേഡീസ് ആണെങ്കിലും നമുക്ക് മനസ്സിലാവുന്നത് രാത്രി ഉറങ്ങാൻ പറ്റാത്ത ഹോട്ട് ഫ്ലഷ്, പിന്നെ മൂഡ് സ്വിങ്സ്, നമ്മൾ അനാവശ്യമായിട്ട് ദേഷ്യപ്പെടുന്നു, കൺട്രോളായിട്ട് കരയാൻ വരുന്നു. റീസൺ എന്താണെന്ന് എല്ലാവരും ചോദിക്കും. ഫാമിലി എല്ലാവരും ചോദിക്കും റീസൺ എന്താണ്. കരയുന്നത് എന്തിന്, ഡിപ്രസ്ഡ് ആയിട്ടിരിക്കുന്നത് പറയാൻ റീസൺ ഇല്ല. അവരൊക്കെ നോക്കുമ്പോൾ എല്ലാം ഇവിടെ എല്ലാം ഫേവറബിൾ ആണല്ലോ, എല്ലാം ഹാപ്പി ആണല്ലോ, ജോലിയുണ്ട്, ഹെൽത്ത് ഓക്കെയാണ്, പിള്ളേർ നല്ല. പക്ഷെ നിങ്ങളെന്താ സങ്കടപ്പെട്ടിരിക്കുന്നത് അങ്ങനെ ചോദിക്കുമ്പോൾ നമുക്ക് പറയാൻ പറ്റുന്നില്ല റീസൺ ചിലപ്പോൾ എന്താണെന്ന്. അപ്പം അതിനെക്കുറിച്ചും കൂടെ ഒന്ന് ഡോക്ടർ ലിസിക്ക് എന്തെങ്കിലും കവർ ചെയ്യാനുണ്ടെങ്കിൽ പറഞ്ഞാൽ നല്ലതായിട്ട്.
ഒരു വാർത്തയെ കിട്ടിക്കൊണ്ടിരുന്നതാണ്
Okay. Yeah, I think that's a good question. So, ഞാൻ പറയുന്നത് മെനോപോസ് എന്ന് പറയുന്നത് all who are born as a woman have to undergo menopause. അതൊരു നേച്ചറിൻ്റെ ഒരു റോളാണ്. ബിക്കോസ് that is the time when the ovaries stop producing eggs. You are no more fertile and all the ovarian function stops. അതാണ്. So it causes a lot of changes in your life. അത് it starts around ചിലർക്ക് 4 or 5 years before ആയിരിക്കും, ചിലർക്ക് even 10 years. So the standard age for menopause is 45 to 52. Australian standard is 45 to 52, but mostly majority will attain menopause by 50. And so the changes can start about 40 or even earlier. So menopause, ചിലർക്ക് premature menopause വരാറുണ്ട്. That is, if changes start before 40, it is premature. And 40 to 45 is called early menopause. The standard age is 45 to 52. അങ്ങനെ അതിലെപ്പോഴെങ്കിലും ആകാം. So what happens in the perimenopause is the estrogen, that is the female hormone, the levels start to be up and down, and you get symptoms like hot flushes, mood swings, and dry vagina, and sex difficulties, and emotional problems all start when the estrogen level dips. അങ്ങനെ അതിങ്ങനെ ഫ്ലക്ച്വേറ്റ് ചെയ്ത് ഒരു ലെവല് ലോ ആയി കഴിയുമ്പോൾ ഓവറിയുടെ ഫങ്ഷൻ എല്ലാം നിൽക്കുമ്പോൾ ദെൻ ആ ലോ ലെവലൊക്കെ മെയിൻറ്റെയിൻ ചെയ്യും. അതാണ് menopause എന്ന് പറയുന്നത്. So I don't know if you are concerned about that. One way of checking, we can do the hormone check, and with your symptoms we can assess your hormones, and ideally we have to do 3 consecutive months of hormones and see if the levels are in the menopausal age. Then we can diagnose premature menopause, which is starting early. And if you want treatment, there is treatment called menopausal hormone therapy, which can stabilize your hormones, and you can continue up to the age of 60. And by the age of 60, your body will adjust to the low levels, and then you can stop it after if you want. അതിനെപ്പറ്റി കൂടുതൽ ചോദ്യങ്ങൾ, ഹോർമോൺ റീപ്ലേസ്മെന്റിനെ പറ്റി അങ്ങനെ ചോദ്യങ്ങളുണ്ടോ നിങ്ങൾക്ക്?
ഉണ്ട്. ഹോർമോൺ റീപ്ലേസ്മെന്റ് ഒത്തിരി കോംപ്ലിക്കേഷൻസ് ഉണ്ടെന്ന് പറയുന്നത്. ക്യാൻസർ ഉണ്ടാകും, ബ്രസ്റ്റ് ക്യാൻസർ വരും, ഇങ്ങനെയൊക്കെ. അപ്പം നമ്മളതിനകത്ത് സേഫ്റ്റിയാണ്. അപ്പം അങ്ങനെ ഇത് എല്ലാവർക്കും പറ്റുന്നതാണോ അതോ
ഹോർമോൺ റീപ്ലേസ്മെന്റ് പറ്റാത്തത് ഒന്ന്, എന്തെങ്കിലും ബ്രസ്റ്റ് ക്യാൻസർ, വല്ല പ്രീവിയസ് ക്യാൻസർ ഹിസ്റ്ററി, എസ്പെഷ്യലി ബ്രസ്റ്റ് ക്യാൻസർ ഉള്ളവർ ഇസ് നോട്ട് സ്യൂട്ടബിൾ ഫോർ ഹോർമോൺ റീപ്ലേസ്മെന്റ്. പിന്നെ വീനസ് ത്രോംബോ എംബോളിസം എന്ന് പറയുന്നത് ബ്ലഡ് ക്ലോട്ട്സ് ലങ്സിലോ DVT അങ്ങനത്തെ ഹിസ്റ്ററി ഉണ്ടെന്നുണ്ടെങ്കിൽ വി ഡോണ്ട്, ബിക്കോസ് ദാറ്റ് ഇൻക്രീസസ് ദി റിസ്ക്. അതേ ഉള്ളൂ.
ഹോട്ട് ഫ്ലഷ് റെഗുലേറ്റ് ചെയ്യാൻ എന്തെങ്കിലും വേറെ ഉണ്ടോ?
ഹോട്ട് ഫ്ലഷ് ഒന്ന്, നമുക്ക് ഫിസിക്കലായിട്ട് കീപ് യുവർ ബോഡി കൂൾ, അതിന് യൂസ് എ ഫാനോ, നമ്മളിങ്ങനെ അങ്ങനത്തെ അധികം ഹീറ്റ്, ലൈറ്റ് ക്ലോത്ത്സ് അങ്ങനെയൊക്കെ ഉപയോഗിക്കാം. There is a medicine called Viosa, which is recently in the market, which is not hormonal. You can use that to reduce the symptom. It's a bit expensive, but it is found to be safe. You can use it. It costs about $80 per month, $180. And risk for about hormone replacement, you don't have to worry so much. They are now promoting hormone replacement. It is considered to be very safe. And there are body identical hormones which are very safe apparently, not like the previous hormone replacement. There are new medicines.